Hello. Okay, it's Dawn, and this is my critique of the videos that I just recorded for pharmacology information regarding serotonin. A couple of things prior to this assignment and before I did this video, I was pretty confident with my knowledge about Prozac and the serotonin class of medications. When I'm videotaping like this, I'm not the most comfortable. I feel like watching the video, I could definitely smile more. As you can see, I'm trying. When I'm with a patient or a resident or family, and I'm interacting one-on-one, I'm probably just as earnest, just as serious in my delivery as I was on the video. So I'm watching that going, yeah, I could definitely relax a little bit. But I'm also very, I take it seriously, the information that I need to convey to make sure that I'm doing my due diligence by giving the proper guidance, the proper information. I'm aware of lab values and things that need to be looked at. I think that can be intimidating, and actually a lot of patients, unless they're asking specifically for it because they have the knowledge of it, it can just be a lot of noise that they don't want to hear. It's bad enough that, okay, well, I had to go to the doctor, and okay, well, now I'm on this medicine and I'm not really sure what it's going to do to me. I just want to feel better. And so I'm not trying to oversimplify my delivery when it comes to that. I just don't want to overwhelm. So watching my videos, I feel like, yeah, I could definitely do better. I could definitely, I look down a lot like I'm doing right now because I'm thinking and I'm trying to make sure that I'm bringing in all the points, the valid points that I wanted to bring in. I do a lot of extemporaneous talk, but I'm no problem with grabbing a drug reference book, flipping it open and saying, here's the medication we're talking about, this is what it says, let me break this down for you. Or, you know, as in my patient teaching video, I did have a printout that I kind of slid across the table to simulate that I'm going to be giving this to my client, because it's important that they have various methods to access the information. When you're newly diagnosed with something and you're sick, you're overwhelmed as it is, and you're kind of freaking out inside trying to figure out how am I going to manage all this and what's happening. I think as caregivers and as nurses, it's important to understand that perspective. I'm working on my therapeutic communication, which is to say I don't want to come across as too clinical. I don't want to come across as too impersonal. There's definitely a fine line when we have to give information or when we have to assess someone, and we're looking at certain things and trying not to be obvious about our assessment. If you know, especially in mental health, if you feel like, you know, you're making somebody anxious, I don't want to do that. And I'm not saying that I'm anxious when I'm giving care. I'm saying I think that I could be construed that way. So again, more smile. Got to work on that. It's not easy for someone who's just really serious all the time. I try to make sure that if anybody has questions and I don't have an answer, because I'm not a walking encyclopedia, I have no problem looking it up, going to the internet, doing what I need to do, referring to somebody else with maybe more experience. So in general, sure, I can always do better. I'm going to always want to do better and strive to do better. I think I have a good grasp, but I think with practice and just repetition, as with anything, then it becomes second nature and my delivery will get better. Thank you.